Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Tari Dias Lara Putri. You can call me Tari. I'm from RKI class batch 1, nursing major Poltekkes Kemenkes Bengkulu. Here I will explain about physiology thermoregulation system. Thermoregulation is a physiological regulation of the human body regarding the balance of heat production and heat loss so that body temperature can be maintained constantly. The balance of body temperature is regulated by physiological and behavioral mechanism. In order for body temperature to remain constant and within normal limits, the relationship between heat producibility and heat expenditure must be maintained. Relationships are regulated through neurological and cardiovascular mechanisms. Nurses apply knowledge of a temperature control mechanism to improve temperature regulation. The hypothalamus located between the cerebral hemispheres controls body temperature as the thermostat works in the home. The hypothalamus perceives small change in body temperature. The anterior hypothalamus controls heat expenditure and the posterior hypothalamus controls heat production. Factors affecting age. At birth, the baby lives a warm environment which is relatively constant. Entering in an environment whose temperature fluctuates rapidly, the baby's body temperature can respond drastically to change in ambient temperature. Newborn expel more than 30% of their body heat through the head. Therefore, it is necessary to use a head covering to prevent heat expenditure. When protected from extreme confinement, the baby's body temperature is maintained at 35.5 degrees Celsius to 39.5 degrees Celsius. Heat production will increase as the baby grows into children. Temperature regulation is unstable until puberty. The normal temperature range drops gradually as a person approaches old age. The elderly have a narrower body temperature range than early adults. Oral temperature of 35 degrees Celsius are not prevalent in the elderly in cold weather. B. Sport. Muscle activity entails an increase in the blood supply in the breakdown of carbohydrates and fats. This leads to increased metabolism and heat production. Any kind of exercise can increase heat production, as a result of which it increases body temperature. Long strenuous exercise, such as long runs, can temporarily raise body temperature to 41 degrees Celsius. C. Up to hormones. In general, women experience a greater fluctuations in body temperature than men. Hormonal variation during the menstrual cycle lead to fluctuations in body temperature. Progesterone levels increase and decrease gradually during the menstrual cycle. When progesterone levels are low, the body temperature is several degrees below the limit. Low body temperature lasts until ovulation occurs. Temperature change also occur in postmenopausal women. Women who have stopped menstruation can experience a period of body heat and sweat profusely, 30 seconds to 5 minutes. This is due to unstable vasomotor control in vasodilatation and vasoconstriction. D. Circadian rhythm. Body temperature change normally 0.5 degrees Celsius to 1 degree Celsius over 25-hour period. However, temperatures are stable rhythm in humans. The lowest body temperature is usually between 1 o'clock and 4 o'clock in the morning. Throughout the body, body temperature rises until at 18 and then drops as in the early hours of the morning. It is important to know the temperature patterns is not automatic in people who work at night and sleep during the day. It will take 1 until 3 weeks for that turnaround to change. In general, the circadian temperature rhythm does not change with age. Research shows peak the body temperature is early morning in the elderly. E. Stress. Physical and emotional stress increases body temperature to hormonal stimulation and innervations. Such physiological change increase heat. Clients who are anxious when entering a hospital or doctor's practice, their body temperature can be higher than normal. F. Milieu. The environment affects body temperature. If the temperature is studied in a very warm room, the client may not be able to regulate body temperature to a heat release mechanism, and the body temperature will rise. If Kin is in an environment without warm clothes, the top temperature may be low due to effective spread and conductive heat expenditure. Infants and the elderly are most often affected by ambient temperature because their temperature mechanism is less efficient. Temperature change. Change in body temperature beyond the normal range affect the set point of the hypothalamus. This change can be associated with excessive heat production, excessive heat expenditure, minimal heat production. Heat expenditure is minimal or any combination of such change. The nature of this change affect the clinical problems experienced by the client. A. Fever. Fever or hyperpyrexia occurs because the heat producing mechanism is unable to maintain the speed of overproduction of heat expenditure, resulting in an abnormal increase in body temperature. The rate at which fever threatens health is often a debatable research among healthcare providers. Fever is usually harmless if it is a temperature below 39 degrees Celsius. A single temperature reading may not indicate a fever. Davids and Lenz recommended determining fever based on several temperature readings in different time of one day compared to those normal temperatures at the same time, in addition to vital signs and symptoms of infection. Fever is actually the result of a change in the set point of the hypothalamus. B. Heat exhaustion. Heat meltdown occurs when the process which results in excessive loss of fluid and electrolytes caused by a heat-exposed environment. Signs and symptoms of lack of fluid volume are common during heat meltdown. The first action is to move the client to a colder environment and improve fluid and electrolyte balance. C. Hyperthermia. And increase the body temperature with respect to the inability of the body to increase heat expenditure or decrease heat production is hyperthermia. Any disease or trauma to hypothalamus can affect the mechanism of heat discharge. Malignant hyperthermia is a congenital condition of not being able to control heat production, which occurs when susceptible people use certain anesthetic drugs. D. Heat stroke. Long exposure to sunlight or high temperature environments can affect the mechanism of heat dissipation. This condition is called heat stroke, a heat hazardous emergency with a high mortality rate. At-risk clients include those who are very young or very old, who have cardiovascular disease, hypothyroidism, diabetes, or alcoholics. Also at risk are people who take drugs that decrease the body's ability to expel heat. Signs and symptoms of heat stroke include anxiety, confusion, delirium, extreme thirst, nausea, muscle cramps, visual disturbance, and even incontinence. The most sign of heat stroke is warm, dry skin. Patients with heat stroke do not sweat because of very heavy electrolyte loss and hypothalamic malfunctions. Heat stroke with a temperature greater than 40.5 degrees Celsius results in tissue damage to cells of all organs of the body. Vital signs express body temperature sometimes as high as 45 degrees Celsius, tachycardia, and hypotension. The brain may be the organ that was first exposed due to its sensitivity to electrolyte imbalance. If the condition continues, the client becomes unconscious, the pupils are not reactive. Permanent neurological damage occurs unless the cooling action is immediately initiated. E. Hypothermia. The expenditure of heat due to constant exposure to cold affect the body's ability to produce heat, resulting in hypothermia. Hypothermia is classified through core temperature measurements. This can happen by change or accidentally during surgical procedures to reduce metabolic needs and the body's a need for oxygen. Accidental hypothermia usually occurs gradually and goes unnoticed for several hours. When the body temperature drops to 35 degrees Celsius, the client expresses signs uncontrolled shaking, memory loss, depression, and inability to reflect. If the body temperature drops below 34.4 If the body temperature drops below 34.4 degrees Celsius, the frequency of heart, breathing, and blood pressure drops. The skin becomes cyanotic. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.